Hey everyone, can you hear me? Tom, there, you were frozen for a sec, Tom. Let's dive in. So it's been a while since we've done one of the Zoom COVID press briefings, but given the uptick in cases, we wanted to check in with folks and make sure that we were letting people know what's going on. So we've seen, as you know, uptick in cases in the state and a slight uptick in New Haven as well. I wanted to share some overall numbers with you all. Throughout the course of the virus, we've had in New Haven a total of 3,205 positive cases, with a total of 684 people hospitalized over the pandemic and 113 fatalities. And I'm going to share my screen here. Just a caveat, so the numbers aren't always perfectly accurate because we get the numbers in kind of batches from the state. But this graph gives you an overview of New Haven's cases over the course of the pandemic on the blue line, the state's cases on the gray line, and the fatalities that we've had in New Haven. And obviously the state's cases are much higher. The right axis here is the state numbers and the left axis is the city's numbers. But you can see the state's been increasing at a slightly faster rate of new cases than the city has, but nevertheless, we've experienced recently an uptick in cases. Also wanted to share some updated demographic data. And this largely mirrors what we've been seeing all along as far as the breakdown of race and ethnicity and positive cases. So there's 3 of these slides. This first one, and for folks that used to be, or were on these calls in the past, these are the same that we've always shared. These are positive cases that we've seen throughout the pandemic. Hospitalizations and fatalities. Something really important to underscore is that by and large, people have been very good at wearing masks and social distancing. However, we've seen a little bit of sloppiness, and I think that there's been a lot of frustration, and I think people are getting tired of having to abide by pretty strict guidelines. And I just want to encourage people that we've got to stay the course and focus and make sure that we're continuing, even though it may be difficult to do, continuing to do everything we can to keep each other safe. We've also noted, and the CDC has noted, that kind of small house gatherings have contributed significantly to the uptick in the number of cases that we're seeing around the nation. So people just have to be really careful and continue to be vigilant. I'm going to hand it over to Director Bond to give a couple updates as well.
So good afternoon, and thank you for taking part in this update for the City of New Haven. In addition to the mayor's comment in talking about gatherings, as you know, we are in the midst of fall and approaching many different holidays, and many individuals have been inquiring about the celebration of Halloween. And so we are issuing a guidance from the New Haven Health Department and part of the city on what's permitted and not permitted, and what we're recommending. And so we are really asking individuals to be cognizant and vigilant of what's happening in regards to cases. We are not permitting large gatherings and are asking individuals to please adhere to the governor's executive order regarding events. We are not recommending door-to-door trick-or-treating because it's really difficult to maintain proper social distancing on porches and front doors and ensuring that individuals are going to be at minimal risk of spreading or contracting COVID-19. So we're not recommending door to door. We are asking that we also adhere to the trunk or treating, where children will go from car to car instead of door to door. We are also not recommending that, particularly because it is also difficult, and we are trying to avoid crowding and gatherings of small groups and of sharing of food. We are recommending, and we hope that you, as you're celebrating the fall events and holidays, especially the one that's coming up for Halloween, is that you get creative and think of things such as online parties or contests that can be virtual, car parades that comply with the public health guidance for vehicle-based parades, and drive-by events, contests, or individual dress up or decorate your vehicles, drive-through events that may be coming up, like a drive-in movie, having a movie night, of things of that nature, Halloween themed meals, outdoor restaurants, and of course, whichever you partake virtually or in one of the recommendations that we just provided, we ask that you continue to wear personal protection measures. Those are so critical and remain the basic principles in remaining safe. So correctly wearing your mask and covering your nose and mouth, avoiding any confined spaces, and actively staying a minimum of 6 feet from each other, avoiding washing your hands and sanitizing your hands often, and cleaning frequently in any touched items regularly. And if you're sick, please stay home. We're asking that we're also in the flu season, that if you are symptomatic of any cold symptoms, we ask that you please remain indoors and try to follow the necessary over-the-counter precautions and contact your physician should your symptoms develop or worsen. We have credible recommendations for resources at the City of New Haven COVID-19 page. Our Department of Public Health also issued some guidance and recommendations. And of course, our Center for Disease Control has also issued guidance. And so if you have any questions, as always, the New Haven Health Department is at your service and can be reached at our hotline, 203-946-4949.
Do you have anything else to add, Director Vaughn?
So in addition to that, we have been continuously working to track cases within the City of New Haven. As the mayor mentioned, there has been a slight uptick in cases. And so we've been working diligently with the colleges in our area within any potential clusters, and we're supporting contact tracing efforts. We have also continued to monitor cases in nursing homes, as well as ensuring that we continue our messaging and supporting flu clinics within the city. We ourselves are providing a number of flu clinics throughout New Haven, and we ask that you visit our website so you can get connected to a local flu clinic. So we ask and encourage everyone to do that. With that, I don't have any other updates at this time.
Okay. Any questions from folks? Looks like both Mary and Tom have questions. Mary's trying to talk. You're on mute, Mary.
Okay.
There you go.
The homeless, if that's an issue and where people are going, if you set up places for them, if people are getting sick again, and what's the
Right. I think that it's probably best for us to get you a specific update from Dr. Dalal and his team, because it is something that we're working on as winter approaches, and concerns about making sure that people stay safe. There's still a lot of people that are in hotels. However, there's increased pressure because of housing issues. That our ability to house everyone is a major concern of ours, and it's been a much larger conversation that Dr. Dalal is having with the state and regional partners. We'd be happy to get you a more specific update on the direction that we're taking.
Thanks.
Yep. Tom?
Thanks very much for taking my question. I appreciate y'all sharing that graph at the start. I was just taking a look at my screenshot of it, but could you, and for sharing the total positive cases, hospitalized, and fatalities in the city, but could you speak a bit more to, you described a recent increase, maybe week to week or over the past couple of weeks or month, what, could you tell us how sharp has this recent increase been, and what do you think is causing it?
And so do you want me to take that one?
Yeah, that'd be great.
Yeah, so, for us, we, when we're talking about a slight uptick, we're looking at the last 14 days. And we've seen a slight fluctuation. And I think the mayor mentioned some of the reasonings and what we've been seeing with our contact tracing efforts. There's been small gatherings of individuals getting together and increased activities indoors, as well as some not being vigilant with proper PPE and wearing your mask and wearing it correctly at all times. And so we sort of have been seeing that. And then we had, some minor clusters that we've been closely monitoring as well within the city in regards to our recent cluster within the local university that was announced previously. So that's sort of what we've been seeing. For the last 14 days specifically, we have approximately 63 cases. That's relatively smaller than the other urban cities across the state. However, we were on just 2 weeks prior, we were at 20 cases. And so we're just closely monitoring it. We are still within slow disease growth within the threshold, but we just want to be cognizant because across the state, we're seeing a jump. And we also seen an increase in hospitalization regarding inpatients with COVID-19.
Thank you, Director Bond, for that. That's very helpful. Could you also speak?
Correct me if I'm wrong, Director Bond, but there's no one incident or two incidents that are causing spread. It's just general community spread that we're seeing.
Correct. It's community-wide spread.
And I have let me share this and make sure that Director Bond. This is from our system in the last 2 weeks. The age differential of the cases that we're getting, and it's clear that the 25-49-year-old range is the most cases that we're seeing. 59% of the new cases are in kind of the younger group of folks.
I have kind of a similar question. This is Alex Putterman from the Hartford Current. It looked, according to the state numbers, that the city went up by like 50 cases all of a sudden over the weekend from Friday to Monday. I was wondering if there was any reason for that, if that was backdated data or something, or what happened there.
I think the mayor stated it very clearly. Sometimes we get these data dumps that come into our system, and so there's a slight lag. I know that there was a slight delay with the specifically with one of the labs that caused us to just get this slight delay. Nevertheless, we're certainly tracking in. We're also tracking it through the hospitalization inpatient rate.
So what's the latest on hospitalizations? I'm sorry if you already said that, but how have the hospitalization numbers changed recently?
So we've seen a slight increase in hospitalizations across the state, as the governor has recently announced. And then we currently, our hospitalizations, I'm just pulling it up really quickly. We have approximately, just pulling it up, just want to give you the accurate number. Here we are. So we have about 26 in-house patients, of which 5 are in the ICU. And just about a week ago, we were about 12. About October 4th, we were seeing 12, and then now we're at 26, which is about 10 days later.
Got it. And when you guys referred to one of the local universities, were you talking about the University of New Haven?
Actually, we were not. I was referring to Yale University.
So Yale had a sports.
I see,
yeah, Yale had a sports team that had, I believe it was 6 positive cases.
Got it. Because I know there have been a lot of cases at UNH, and I know that campus is not in the city, but I was wondering if that had any sort of impact on the city of New Haven.
We have not. That's a good question. We have not necessarily seen that through our contact tracing efforts.
And I had just one more question. Obviously, as the weather is getting colder and people are starting to move activities indoors, do you think that that will, or maybe already has begun to cause some amount of increase in COVID transmission?
So we know that indoor air quality is, is crucial, and limited with ventilation. So there is a concern there with the increased indoor gatherings, and so we ask individuals to really try to avoid large gatherings and adhere to sector rules when they are frequently visiting any potential, restaurants or other events that they're attending, to make sure that they're adhering to the sector rules and making sure that they follow the basic principles for safety.
Actually, I lied. I have one more question, if you don't mind.
Tom Breen does it all the time.
I've already asked the mayor this, but I was wondering, Director Bond, if you had any thoughts about whether schools being closed had contributed in any way to New Haven's COVID numbers remaining relatively lower than other cities.
I think there's a variety of things. I think is one contributing factor for certain. I think there are other things that have played a role. Our city has taken extreme measures to ensure that we have a COVID-19 task force, and we do a lot of education and are out weekly at different establishments that we license to ensure that they are aware of the sector rules and provide education to them. So I think there's a number of things that have contributed. And so I don't want to just say isolated to that being a major contributing factor, but definitely played a role.
Thank you, guys. I really appreciate it.
You're welcome.
And just to clarify my statement, Tom Breen always has one more question. Tom Breen does not always lie. Tom Breen doesn't lie at all, but I can see how someone can misconstrue my statement. Tom Breen has a lot of questions, which is a great thing. Any more questions? Kyle, go for it.
I guess I just have one question.
Oh.
Have any restaurants or businesses been closed or cited by the city because of violations
What's your question, Mary?
of the COVID rules?
Have we given
My question is,
citations or closed any restaurants or businesses because of the inspections that you've done?
Yes, and we don't, not because of the weekly inspections, it really varies. We do have a system in place, warning systems, and depending on the imminent risk to the public, but we have certainly closed establishments for a number of violations.
All right, I'd love to get that list. And how long are they closed once you do it? I mean, is there a reinspection process protocol, I guess, right? They would reopen again?
Yeah, so typically when someone is deemed closed for whatever violations they have, they do have to work on a corrective action plan on how they're going to adhere to the sector rules, or redirect them to ensuring that if it's a health violation regarding food or other, they will have a corrective action plan, and their closure will depend upon ensuring that they adhere to complying with either the health sector rules, building, fire marshal. So it really varies on a case-by-case situation on how long they're closed.
All right, so we can get that information.
You can certainly make a FOIO request, of course.
Well, we can get you the information. We can get you the information. Kyle. Mary, you had something else?
When you spoke about Yale, is the only report you're speaking about is the athletes, the 6 students? That's
correct. But on a routine basis, we work closely with all the universities just to provide support as that's part of the reopening guidance. And so we have a good relationship with each of the universities.
Thank you.
You're welcome.
Kyle.
Hello, everyone. I just have a question about the testing efforts. I know I'm wondering, is the city starting to plan to moving back towards sort of the model that was out in the fall, where we had multiple testing sites throughout the city? I know that the schools have testing sites now. So if you could talk a little bit about how you're preparing for the fall, if we're starting to ramp up testing again.
Do you want me to answer that, Mayor?
Sure.
Okay, so we have never scaled down. We actually kept our testing model the same. We did see fluctuation in numbers and in the demand for testing, but we wanted to make sure that testing capacity was still in place and availability for individuals that want to get tested. We have a testing logistics team. We worked very closely with our testing partners to identify any potential gaps and provide support in those gaps, and then have expanded, as you know, we announced yesterday at the Board of Ed meeting our schedule for testing at the different schools and making it available for the communities and individuals that would like to get tested at one of those sites. So we are continuously working in those efforts and feel that testing is of critical importance, and we'll continue to monitor hotspots in our city and continue to expand as needed and support pop-up testing sites as well as many community agencies have events, and they often invite and offer testing at these different community events. So we're really grateful for all of the different stakeholders that are involved in this process.
And we've also thankfully seen an increased capacity by a number of entities. The hospital's doing a lot more testing, as are the federally qualified health centers. And early on in the pandemic, there was not the availability of the kind of asymptomatic testing, but all those entities are now doing asymptomatic testing as well. So it just gives us a lot more flexibility to provide more options because of those partnerships. The hospitals, for example, have been doing pop-up testing with their RV on the green, just as one example. And they're doing a lot of the testing along with our partners at the federally qualified health centers at the schools for the upcoming month.
Okay, so so it sounds like the model has sort of, as you've said, stayed the same, but just the I guess execution's a little bit different because is there still like the Chapel and Day Street site, or Lincoln Bassett I know was a site before? Have those kind of changed too?
So we just as discussed, we sort of modify locations as we monitor the hotspots. Stay Chapel is currently available. There's also a Yale public testing site. We've expanded now. Yale has one at Strong School. So some of them locations just have fluctuated as we've evolved and expanded.
Gotcha. And the
I want to mention, that our COVID-19 testing schedule is on the website. And so we invite individuals to the New Haven COVID-19 testing site to stay up to date on the different schedules that we provide each week.
Gotcha. Okay, great. And the school testing site is open to the community, right? It's not just
correct.
Students. Okay. And then my last question for schools, I guess, would be for maybe Mr. Pinto. How are the schools getting ready? I mean, I know we took 10 weeks to, get them set and prepared. How are we looking with in person?
We are, as of last night, with the Board of Ed affirmed that it is reopening on the hybrid model on November 9th. That's the Monday, 10 weeks from August 31st, which was the start of school. Well, the first official day, although students were actually only online as of the 12th, I believe. I'm sorry, not the 12th, I'm sorry, the 3rd, my mistake. We have been we've been working with the COVID task force, which has included Director Bond's department, the building department. Also, we've had input from the Yale School of Public Health, the Office of Policy Management that oversees school construction. We have gone through with Maritza and with her team, effectively with a fine-tooth comb. We're making sure that we have, everything from, the signage, floor signage, one-way markers, entry and exit only signage, room capacity signage, social distancing signage, elevator capacity signage. In bathrooms, we're turning off, every other stall effectively and reducing usage in bathrooms, turning off every other sink to ensure we have social distancing for people when they're using the bathroom. Lockers won't be used this year, so kids will be carrying their bags, and we're zip tying all the lockers off. we're in the process of finishing up the final 5 or 6 isolation rooms that we need to finish off. We had to do, we had to identify rooms, and in some cases we had to modify the door. The requirements are that the door have a window in it so that the student can be, if necessary, or the symptomatic person can be isolated, but then also maintain observation, while still being separated from the other from staff. So we're finalizing those. We have Fuss and O'Neill on board, who are doing evaluations of all of the HVAC systems. So far, all of them have come back in working order. We are doing some additional duct. They have identified some ventilation cleaning, and we are in the process of, we're scheduled to take delivery of MERV 13 standard filter systems that will be installed. We have them installed in about 7 schools currently, just because they arrived earlier. And we're in the process of, we're expecting towards the end of this week, the delivery of the remaining 35 odd school, and we will have additional staff on to make sure those are installed as soon as we receive them, likely beginning next week. And so that's where we stand. We're in the process of, we're finishing up where we stand on the setup. There are some final things that we need to do at most of the schools, but we're confident they'll be ready on November 9th.
Does that answer your question, Kyle?
Yeah, I think so. It sounds like you're making progress, and according to the school board meeting last night, everything sounds like it's on track for in-person learning.
That's correct.
Yeah, correct me if I'm wrong, but there are 8 schools that are ready to go right now, and all of the other ones are on track. The entire team has made clear that if any of the schools are not ready, meaning they haven't checked all of the boxes on the checklist of things that need to be done for safety, then that particular school would not open as they continue to finalize the safety measures.
Okay. And those learning hubs will stay open in case parents want to keep using those?
Correct. And that's important because in the hybrid model, there's still some days of online learning. And so the learning hubs provide an added support for parents.
And all parents have the option, or all families have the option to remain in remote, if they feel more comfortable in the remote and the remote learning, they can do that. Obviously, it's a little different if you're going to a hub. Presumably, you'd also feel comfortable about going to a school. But yeah, so some students will remain online and remote learning, and then there will be cohorting. The AA, basically Monday, Tuesday will be one cohort, the A cohort, and then Thursday, Friday will be the B cohort. Okay. The younger grades will actually, like the K through 3, will actually be going all 4 days. Wednesday will be a deep cleaning day, so that we will, as we clean between the cohorts.
Okay, sounds good. Thanks.
Thanks, Kyle. Go ahead, Tom.
Thank you. First, I just want to say I always love and appreciate when you all do these. So thank you for doing another one of these virtual updates. I really find it invaluable, and I know our readers do too. So, so thanks for doing that, and I hope that there are more to come. And my only question is about any city plans for outdoor dining, if you have any to share as the weather gets colder. Obviously, a lot of restaurants have taken up a fair amount of sidewalk and street space during the warmer months. But do you, either Mayor, Director Bond, do you have anything you can say right now about what the city's planning to do when it starts snowing or getting very cold in terms of outdoor dining?
The short answer is stay tuned. We're actually having a pretty lively conversation within City Hall about how to support businesses, because it's to Director Bond's point earlier, as people are forced to go indoors, there's just more potential for spread of the virus. And So we're working with the team to try to provide options to restaurants and be more flexible, but don't yet have a finalized plan for.
Okay, that's it for me. Thanks so much.
Yep. Anything else? Okay. Thanks, everybody. We'll try to do these more frequently. It's mostly that we kind of get distracted and there's so many things going on, but I appreciate your feedback, Tom, that these are helpful, and we'll do our best to do them more frequently. Good to see you all. Take care.
Thank you all.